Hi, I'm Tony and I'm a retired NHS children's consultant. I'm really alarmed and upset about the government's attitude to the NHS, made clear in Labour's new Fit for the Future 10-year health plan for England. It's moved right away from the founding principles of the NHS, a national service giving healthcare for all, free at the point of use, publicly funded and publicly provided. That's simple, yet so important for us all. The government is heavily promoting partnership with the private sector now, which takes money and staff out of the NHS, puts profit before people's health, and just walks away if it isn't cashing in enough. These new proposals rely heavily on the private sector, and it's a theme running through every section of the plan like a stick of rock. And when you hear Alan Milburn, the architect of Labour's pro-privatisation in the NHS of the 2000s, and the key influencer of the 10-year health plan, well, you can see what they're up to.
So the plan is very clear, isn't it, about one really big change, which is that we've got to stop viewing the healthcare system in this country as being about a single institution that we happen to call the National Health Service.
Milburn is expanding on his vision to downgrade the NHS from our National Health Service to being just one player in his competitive health market. Just listen to where he puts the NHS, way down his list of players.
A single institution that we happen to call the National Health Service, and instead see it as being an ecosystem of very different providers, from telcos, techcos, of course, private sector providers at the margins, the public sector.
Well, he remembered to tag on the public sector at the end, but then the private sector could not make its profits without the NHS and the public sector educating and training its 1.6 million staff. This Labour government's policy is actually a betrayal of all the NHS stands for, a service for all based on collaboration and not competition and profit.
All too often we have this rather binary debate, don't we, between it's got to be collaboration or it's got to be competition. And most big ecosystems, whether in health or in other walks of life, they have a combination of both. And you need both.
Competition. It's not fair competition when the NHS gives billions of pounds to its competitor, trains the competitor's staff for free, and then sees them going to work for the private sector because of low NHS pay, intense stress, and low morale after successive governments have failed to fund the NHS to meet the public's needs. It's just a stitch-up.
And the role of the centre, by the way, back to that sort of thorny question, has got to be both to manage and convene that ecosystem rather than to direct or run a single institution.
The NHS is not an ecosystem to be speculated on by hedge fund managers and divvied up between private interests, leaving a poor service for poorer people. The NHS is our service and has to remain the National Health Service, providing healthcare for all from the cradle to the grave. And I say, restore the people's NHS, restore the principles on which it is founded, stop feeding the private parasites and invest instead in the publicly provided NHS so that it is once more the most cost-effective and best service able to meet the health needs of the whole population once again.